Hey everybody, it's Doc Bradley. I just had a really troubling interaction with a physician that I was seeing with a family member. I was there to advocate on their behalf, and the interaction was very contentious. And I thought, let me use this opportunity to talk about tools we can use when encountering unprofessional or belligerent people in healthcare, and how we can make sure that we continue to advocate on our own behalf. Okay, so the first thing is that most people feel like I'm a physician. I'm more than likely, I don't have these issues with contentious interactions with physicians or other healthcare professionals, or if I do, I'm able to easily navigate it. And that cannot be further from the truth. And I want to give you an example of something that happened to me this week. So I have a family member who's been having escalating, worsening symptoms. And this is a family member who doesn't like to go to the hospital or to the doctor's office. And I really wanted to go with them to make sure that they weren't going to, basically brush off the symptoms and, give the physician the impression that this wasn't a big deal. So I asked if I could go with them. They agreed. And when I got there, as soon as we got in the patient room and the physician came in, it was already just not a very welcoming environment. The physician didn't even acknowledge that I was there, didn't say good morning, etc. Just immediately started engaging the patient. And so, of course, my family member started downplaying the symptoms and was leading the conversation down a path of this not a very big deal, and I'm just kind of here because I was encouraged to come, etc. And so when there was a lull in the conversation, and I interjected and provided some additional history and information, and the encounter immediately escalated to just being very contentious. The physician asked me to give them a differential diagnosis on the symptoms that I was relaying to them, and just was very, just became very unapproachable, hostile, condescending, etc. And so I just wanted to tell you and talk you through what I did in this situation. The first thing was that I took a breath. It's very difficult in these situations where you feel an energy that is contrary to safety and being welcome. And so I took a breath. I allowed the physician to get all of their points out, all of their, complaints about what I was saying, etc. And then I just relayed the information in a very fact-based, concise manner. How long the symptoms had been going on, how they continued to worsen, and what my concerns were in regards to my family member and their well-being. And believe it or not, just me taking a breath and waiting and allowing them to respond was enough to start to lower the temperature. And so for you guys out there, if you're a healthcare professional and you think you can relay all of that just verbally, great. Otherwise, I would encourage you to bring a record. Like if you're living with your family member, or your family member's been providing information over the phone, or if it's a friend, whoever, just write down, particularly if their symptoms have been getting worse, like, hi, on Monday, this is what happened on Tuesday, Wednesday, etc. These were the things that we did to try and alleviate the symptoms. Just provide a timeline. That would be great. Other things are, there are different ways where you may encounter contentious behavior. So if you call, I recommend, whether you have a great conversation on the phone or not, I always take people's names and information, extension numbers, so that I can refer back to it, so that I have a record of who I spoke with. Also, when you're in the office, if you speak with somebody on an intake when you're getting registered, and they're just not very welcoming, or it's contentious, etc., they're condescending, or they're unprofessional, or they're ignoring what you're saying, write their information down, and do not hesitate to follow up with whoever's managing the department or an administrator in the hospital or the clinic. You can follow up as long as you have that information. Now, back to the physician. With that information, like when I relayed everything, my question is, what is it that you want to do? And I defer to your judgment because this is your area of expertise. Just those words also de-escalated. Like, I'm not trying to be the patient's physician. I'm trying to advocate on this patient's behalf because they're my family member. They've asked me to be here, etc. The other thing is, don't hesitate. Just because it's a physician or you feel like somebody who has power, don't hesitate to take that physician's information and relay it to their manager or the administrator and say, hi, this was the encounter that I had, and I'm concerned in regards to care, in regards to follow-up. The other thing is, I would insist upon whatever discussion that you have, whatever the diagnosis, the treatment plan, and your discussion, that it's documented in the patient's chart. So whether the patient is you, whether you're advocating for someone, please note our discussion in the chart. Ask what the plan and treatment is going to be. If it is not addressing the issues that have been discussed, ask them to document that and state why these plans are not being implemented. Believe me, these type of questions will give people pause. They know that you understand your power. They understand that you have rights, and they will likely modify what they're going to do based on the discussion. Unfortunately, there are people who are going to just try and blow you off, whether it's time restraints, they're exhausted, whatever it is. But these are tools that you can use to advocate on your own behalf. And believe it or not, after all of this contentious interaction that we had, because the other thing is, the patient is there waiting to be treated. So relaxing, taking a breath, etc., all of these things, the conversation changed 180 degrees by the end of the visit. There were labs and other radiology studies ordered based on our discussion. We had a treatment plan. We had a follow-up. And, I can tell you that over time, I have learned to modify my own behavior when I encounter these contentious interactions, because me escalating is not going to get the patient or myself better care. It's only going to worsen things. And it's unfortunate, but it's true. So I really think you guys should focus on just kind of taking a pause, documenting things before you can get there, like in a preventive way, to make sure that you have a timeline of everything, you know what the symptoms are, etc. And then going up the chain of command if you need to, going to the manager, the office manager, the practice manager, the administrator on call, the nurse manager, whoever it may be. Documenting who you're talking to so that people know that they will be held accountable for their behavior. And then documentation of the patient. And if you're the patient, great. Otherwise, if you're advocating for someone else, that there's documentation in their chart that you leave with that day, that this was the discussion, these were their symptoms, this is what the plan is, and this is why or why not the issues that you discussed will or will not be addressed. So I hope these things help. I'm still going back with this family member for follow-up studies, etc. But just always know that you have power. The final thing is knowing that you have the option of getting a second opinion. There's a customer service number on your insurance card. Reach out to them and say, hey, I'd really like another physician or healthcare professional in my network to follow up with. The other thing is reach out to other physicians and healthcare professionals that you trust, or family and friends, and say, hey, I have this situation. I really am having a difficult time with this specific provider, and I need recommendations for additional resources. So I hope this helped, and I'll see you guys soon. Let me know your comments, and I look forward to our discussion. Peace.